I'm Dr. Pete Economo, the East Coast psychologist,
And I'm Dr. Nikki Rubin, the West Coast psychologist.
and this is When East
Meets West. Pete, we have a special episode today because we are honoring the passing of a great contributor, or really the father of cognitive therapy, is referred to Dr. Aaron Beck, who just passed away at the age of 100 years old on November 1st, 2021. So we wanted to talk about him today. Hi.
Hey, yeah, thanks for bringing this up. This was a really good idea, especially for all the CBT that you and I do. And God, 100 years, like, I don't know.
Yeah, I know. It's pretty amazing.
And he was
And
doing research still into
he
his
was
90s.
he no up until like till he died, actually.
I know.
Yeah, no. Yeah, this is so, Pete and I wanted to talk about Aaron Beck today for a lot of reasons. One, as we just mentioned, he's known as the father of cognitive therapy. That's
Yes.
how he's known in the field. And just to, kind of illustrate how much of a loss this is for the cognitive and behavioral therapy communities. For us, it would be like if we were alive during the days of Freud and Freud died, like
Yeah.
it's to that level, that he, you
Or
know,
like when Michael Jackson died or Whitney Houston.
right, exactly. No, exactly. Yeah. For a non psychology example, absolutely.
Exactly.
That this, I actually, when I learned of his passing, not only did I feel very sad, I also was like, I felt this gratitude that I was alive during the time that he was alive. And, I had the
Yeah.
great fortune of getting to meet him briefly and watch him speak
Yep.
on a panel.
Yep.
But that's how important he is. And so that's why Pete and I, want to talk about this. So, but before we wanted to share one of the little obituaries about him to give readers a little bit of information about him. Is there
Yeah.
anything else you wanted to add before I jump into that?
Yeah, well, I think, like you said, I like that you just said that. It was good perspective to add about what it means for his passing. And, you and I both identify as cognitive behavioral therapists.
Hmm.
And so for us, this is a huge impact in how we got to where we are today. And he really committed his entire life. I mean, it's certainly his
Hmm.
professional life,
Hmm.
to understanding thoughts, feelings, and behaviors. And,
Hmm.
so thankful. And his legacy lives on, which I'm sure, I don't know, I didn't read what you're about to read, but, right here on the East Coast, we have the Beck
Hmm.
Institute in
Hmm.
Pennsylvania,
Hmm.
which his daughter runs and has been running. And so I guess
Yes.
we'll talk about that. So yeah, it's been,
Yeah.
you and I both have attended several of his stuff.
Yeah, no, absolutely. Yeah, and we'll give a little bit more information about sort of his history.
Yeah.
We'll include in our in the description. There's some great articles about him and
Yeah.
some things. We'll include some more information. But just to start, I wanted to read the obituary that was posted by Dr. David Tollin, who's the current
Oh,
ABCT president. And
yeah.
ABCT, for listeners, it's the Association of Behavioral and Cognitive Therapies. So it's a national organization that many in this broader CBT community are members of. So
Mhm.
so he posted this to say, he said, "It's with great sadness that I inform you that Aaron T. Beck, MD, has passed away at the age of 100. He died peacefully in his home, surrounded by his family. Dr. Beck, widely considered the father of cognitive therapy, was the driving force behind two major revolutions in psychotherapy, beginning in the 1960s. The first of these was the recognition that conscious cognitive processes can drive emotional and behavioral responses, and that a therapy overtly targeting those cognitive processes can result in diminished depression, anxiety, and other reactions. The second revolution was the insight that, like pharmaceutical treatment, psychological treatments can be quantified and studied. This idea stood in contrast with the zeitgeist of the times, wherein psychological processes, and by extension, the treatments thereof, were thought to lie outside the domain of science. That's a big deal, you guys. So people before didn't
Yeah.
even think, they thought you can't even study this stuff. So he was the first person to do this. By conducting large randomized controlled trials of cognitive therapy for depression, Dr. Beck launched an unprecedented movement toward the identification of empirically supported psychological treatments. In 1982, American psychologists named Dr. Beck as one of the most influential figures in the history of the field. Dr. Beck, along with his daughter Judith, founded the Beck Institute for Cognitive Therapy in 1994 with the aim of training CBT practitioners around the world. And then he goes on to say that as ABCT members, so basically anyone who identifies in some form of practices some form of CBT. Most of us work in some combination of psychological treatment, clinical research, and training. Dr. Beck's work is evident across all of these domains, and the field owes him a debt of gratitude.
Yeah, there's no doubt about that. Thanks for reading that. That was beautiful. Toland's also, I mean, we use his text a lot in our courses.
Yes,
Yeah.
yes.
I didn't realize he was president there now.
Yes.
Yeah. And Aaron also wasn't that poorly educated. So Brown and Yale.
Yes, right. Yes.
And I think for listeners, it could be helpful. He was a psychiatrist. And so even though he's kind of been seen as one of the top influential psychotherapists too, as a psychiatrist in today's world, they tend to do a lot of medication management, more so compared to psychologists where we're doing the psychotherapy.
Yeah, absolutely. And part of it, I think this is maybe where it's important to tell a little bit of like his story of how this came to pass. So, and even as a funny thing, I'll just say, and by the way, I didn't know this until one of my, I have as Pete does as well. I didn't personally know him. I have a lot of colleagues that did and worked personally with him. And so his name is Aaron Tempkin Beck, Aaron T. Beck, but apparently he went by Tim. By his friends, call him Tim Beck. And I remember when I was training in in grad school, one of my, they kept going like Tim Beck. I'm like, who's Tim Beck? And they're like, Tim? And they're like Aaron Beck. I'm like, fascinating, cool. He's got a.
Oh, I never knew that.
Yeah, Tim Beck. Yeah. Tim Beck. So, so anyway, the story is so basically, Aaron Beck was a psychiatrist, and at the time, so in the 50s and 60s, when he was training, psychoanalysis was still that was the psychotherapy training. There was no cognitive behavior therapy at the time. So he was going through psychoanalytic training, and there's a number like of stories that are told, but one is basically, and again, this will be in the article that we'll link in the description, is that he was talking to a patient, and he, and in psychoanalysis, and we talked about this in the Problem with Freud episode, the analyst sits behind the patient, right? Yeah. So as not to influence the transference, right? Am I saying exactly that accurate? Right. Okay, that's right. Okay. So they sit behind the patient. Behind the patient, the patient's lying down, and the patient was talking about something, and Dr. Beck made an interpretation, which is one of the main sort of interventions, which he said something, you're feeling this way because of this. And one of my sort of, one thing I don't like about that is that interpretations are sort of stated as if they're truths, right? As when interpretation in and of itself means opinion, right? Your thoughts. So he said that, and the patient said, "No, that's not right at all, Dr. Beck. I'm thinking that that I'm probably boring you," and this surprised him. And so basically, it was one of the first times where he's like, what he was thinking the patient was thinking is not right. So over time, as the story goes, is that he eventually sat the patient up. So they were and faced them face to face, and began to sort of assess what was going on in their minds. And what he found was they were having what he eventually termed automatic thoughts. Yeah. And he was having automatic thoughts. And he started to notice that these thoughts were influencing mood. So also psychoanalysis, there's, a theme or a theory that like depression was caused by, I don't know if it was like hatred towards the self or, anger towards himself. And what he found was he started to study it. That wasn't true. that in fact, that it was that they had, they were having sort of negative predictions about the future, things like that. So anyway, he began to study it. And it's so important to emphasize this. He was basically like laughed at the time that he was actually told by his, the people training him that he wasn't analyzed well enough, quote unquote, which is a real dig coming from analysts. I can't emphasize that enough, which is basically saying he wasn't really doing the work on himself. When in reality, he was, you guys got to think about this. He was like bucking the whole system because he was saying, no, I see it a different way. And from what he did, everything that Pete and I do, my colleagues and I were talking about this, we're all getting emotional saying it. It doesn't matter if you do DBT or ACT or any of this. All of it grows out of what this one person did by getting curious and saying, I don't know if this makes sense.
My interpretation was just an automatic thought.
Was just an automatic thought. And I think
Yeah.
it's so, and he was known as a very gentle and lovely man and very, very curious, right? Very non-judgmental. And it's like, I think that that's such a wonderful model for what we do in our field, because it's, that's how we move science forward, right? If, like we always talk about, if tomorrow CBT they said it didn't work, we would stop doing it.
Yeah.
Right.
And what an incredible life. I mean, again, I can't emphasize that enough. Like, to live to 100. I mean, that's really incredible. And he had 4 children.
Mm-hmm.
And so, I think his wife died this year too.
No, she's still alive, and she's still alive, and she was a very interesting family. His wife was a judge. Well, because I was reading.
Well, the 2 daughters were judges, I think.
Well, so 2 daughters and 2 sons. One son, I believe, is an epidemiologist.
No, 3 daughters and 1 son.
It's 3 daughters. I think it's 2 sons and 2 daughters.
I was just reading it. It's 3.
Oh, it is.
It's okay. Anyway, you're right.
Oh, my bad. Sorry, my bad.
He had 4 children. Oh, no, I think you're right. So you're always right.
No, I'm not always right. I was reading.
So Phyllis, his wife. That's what I was reading. Is Phyllis his wife?
Yeah, his wife was.
She was the first woman judge. Oh, you knew this,
Pennsylvania.
Right?
First woman judge in Pennsylvania.
So you're right. It's 2 and 2. I'm sorry. I'm just going to shut up and listen to you and learn.
No. So, no. His wife,
listeners, as I've always said, Nikki is way smarter than I can ever be.
It's not true at all.
So the floor is yours.
No, it's not true. His daughter Judith is a clinical psychologist.
Yes.
So she runs the Beck Institute. They founded it together. His other daughter is also a judge. Yes. His wife was the first female judge I think Superior Court. I don't know if it was Supreme Court. Appellate court, in Pennsylvania. One of his sons, I believe, is an epidemiologist, and the other one's a social worker.
Oh, wow.
And so, a lovely family.
A family who doesn't dislike education.
Yeah, but Pete, I think so. I'm just curious about some of your thoughts. For me, it was emotional. Like, I felt emotional about it. Like, I felt like such a depth of gratitude that this one person, like, I felt very moved by it, honestly. Like, that, again, we were so lucky to have that he lived this long. Sometimes people that do wonderful things, it's like they die too soon. We don't get them that long. Yeah. And we had this amazing person who, like, because of him, millions and millions of people, have because they
say that he really influenced David Burns, which, you and I both know, and study well too. So I think the influence he's had in other, the thing I like about what we do, especially say at the university setting, is we are mentoring, supervising. Mm-hmm. And I love that, because that's just, providing skills and knowledge to people that can then go provide this really amazing work. And
well, that's really, I'm glad you're saying that, because I think I can use some other examples of some big names in the field that he mentored that,
of course you can.
Well, so Jeff Young is the creator of schema therapy, which is a type of CBT, and Aaron Beck was his mentor. Yeah. He also mentored my former boss, Bob Leahy, who wrote the book The Worry Cure, which is well known in our community. And then, on the listserv for acceptance and commitment therapy ACT, which, it's in the third wave, it's behaviorally based. Mm-hmm. Steve Hayes, one of the creators of ACT, wrote a lovely response about Aaron Beck, saying basically how kind Aaron Beck had always been to him and how supportive of the treatment. And he said, never, something to the effect of, never misinterpret like scientific disagreements for not respecting one another. Yeah. Right. And so again, that's what I mean about, like, even ACT, which is different, right? We're not about challenging thoughts in ACT. Again, it's because of Aaron Beck that we are able to use randomized control trials to study psychological.
He was the reason. Yeah. He's published over 600 articles, I think over 25 books. I mean, it's really like, thankfully we'll have that for the rest of our careers. Yeah,
no, absolutely. Well, Pete, and I'm not sure if you're aware of this, and if you're not, I just love to be so excited if you watch it. But do you know that? So in 2006, and I can put a clip of this in there as well, Aaron Beck did a talk with the Dalai Lama, actually. Do you know about this?
No, I don't.
Oh, this is going to be your favorite thing of all time when you watch it. So
listeners, Nikki's definitely a bigger nerd than I am.
I do like my nerdy stuff. Yeah, I own that. So because it's a lovely talk, because they talk about all the overlap between Buddhism and cognitive behavioral therapies, which, I don't know, we maybe know a little something about that on When He Meets Us.
We sure do. And also another one of your former supervisors, published a book on Buddhist psychology, which was heavily influenced by Aaron Beck.
Yes, Dr. Dennis Church. But absolutely.
Yeah.
So, this is, he was truly one of the great thinkers and scientists and therapists, and we, like I said, Dr. Tolan says, we owe him a debt of gratitude. And I think, it was funny. I was sharing this with my mom. I was telling her about this. I was trying to explain what a big deal it was that he passed. Yeah. And she was all saying it was moving to her when she heard when I was explaining about what he's done. And she said, she was reminded there's a saying sometimes in Judaism, you save one life, you save 1,000 kind of thing. And I think, I think that's one thing that we can acknowledge about Aaron Beck, that because one person, was brave enough to, listen to his own gut and be curious and challenge something that he didn't think was working. He alleviated suffering for, millions of people, and his work will live on. This has been When East Meets West. I'm Dr. Nikki Rubin.
And I'm Dr. Pete Economo. Be present, be brave. This has been When East Meets West. All material is based on opinion and educational training of Drs. Pete Economo and Nikki Rubin.
Content is for informational and educational purposes only.